Cuerpo Amarillo Fuerte Injection Introduction. Cuerpo Amarillo Fuerte Injection is a hormone produced in the body and found in many forms of contraception, including birth control pills. It has a variety of important physiological functions and is involved in menstrual cycles, maintaining the endometrium of the uterus, and regulating fertility. It is also available in synthetic forms that can be used to treat a variety of conditions and diseases. Cuerpo Amarillo Fuerte Injection has a variety of benefits and is used for many different purposes. It can be used to regulate and treat menstrual cycles, to treat premenstrual syndrome, PMS, endometriosis, infertility, menopausal symptoms, and recurrent miscarriages. Mechanism of action. Cuerpo Amarillo Fuerte Injection is a steroid hormone that is produced by the ovaries and placenta in women. It acts via binding to progesterone receptors, PRs, which are present in the endometrium, myometrium, breast, hypothalamus, pituitary gland, ovary, and other target tissues. The action of progesterone is to upregulate progesterone-induced genes and downregulate progesterone-suppressed genes. How long does it take to work? The effects of progesterone vary depending on its administration. When taken orally, it can take up to 12 hours for the hormone to be absorbed into the bloodstream. When taken transdermally, it takes up to 24 hours for the effects to be felt, as the hormone has to penetrate through the skin. It has also been shown that the effects of oral progesterone can be felt up to 6 hours after administration, while the effects of transdermal progesterone can be felt up to 12 hours after administration. Absorption. Cuerpo Amarillo Fuerte Injection is absorbed through the gastrointestinal tract when taken orally or through the skin when taken transdermally. It is first lipophilically dissolved into the body, then hydrolyzed and converted into absorbable molecules. Route of elimination. Cuerpo Amarillo Fuerte Injection is eliminated primarily through the liver and kidneys. It is metabolized into pregnanediol, pregnenetriol, and progesterone glucuronides. The metabolites are then excreted in the urine and feces. Dosage. The dosage of progesterone depends on a variety of factors, such as the medical condition being treated, other medications being taken, the patient's age and weight, etc. The dosage of progesterone for oral administration ranges from 5 to 200 milligrams per day, and for transdermal administration ranges from 25 to 200 milligrams per day. It is important to consult with your physician or healthcare provider to discuss the appropriate dosage for your individual needs. Administration. Cuerpo Amarillo Fuerte Injection can be administered orally, transdermally, or intramuscularly. When taken orally, it should be taken with food to ensure proper absorption. When taken transdermally, the patch should be applied to a dry, clean area of the skin and changed as directed. For intramuscular administration, the injection should be given by a healthcare professional. Side effects. Cuerpo Amarillo Fuerte Injection may cause some side effects, some of which may include headache, nausea, breast tenderness, rash, mood changes, hair loss, dizziness, and abdominal pain. Other more serious side effects have also been reported, such as depression, chest pain, dizziness, vision changes, shortness of breath, and swelling. It is important to consult with your physician or healthcare provider to discuss any potential side effects. Toxicity. Cuerpo Amarillo Fuerte Injection is not considered to be toxic in therapeutic dosages. However, it is possible to have an overdose of progesterone, and it is important to take the medication as prescribed and not exceed the recommended dosage. Overdoses of progesterone can cause side effects such as abdominal pain, nausea, vomiting, and depression. Precaution. It is important to talk to your doctor or healthcare provider before taking progesterone. This is especially important if you have any medical conditions, such as high blood pressure, heart disease, diabetes, kidney disease, thyroid disease, etc. It is also important to tell them about any other medications you are taking, as some medications can interact with progesterone. Interaction. Cuerpo Amarillo Fuerte Injection may interact with a number of medications, including anticonvulsants, antidepressants, antiarrhythmics, antifungals, antibiotics, immunosuppressants, and HIV medications. It is important to consult with your doctor or healthcare provider to determine if any medication interactions are possible. Disease interaction. Cuerpo Amarillo Fuerte Injection may interact with certain diseases, such as asthma, diabetes, epilepsy, and migraine headaches. It is important to discuss any medical condition with your doctor or healthcare provider before taking this medication. Drug interaction. Cuerpo Amarillo Fuerte Injection may interact with a number of medications, including birth control pills, antibiotics, antifungals, and HIV medications. It is important to discuss any medication interactions with your doctor or healthcare provider. Food interactions. Cuerpo Amarillo Fuerte Injection should be taken with food to ensure proper absorption. It may interact with grapefruit juice, grapefruit seed extract, and any other food or drink containing red yeast rice. It is important to discuss any food interactions with your doctor or healthcare provider before taking progesterone. Pregnancy use. Cuerpo Amarillo Fuerte Injection is not recommended for use in pregnant women. If you are pregnant, it is important to talk to your doctor or healthcare provider before taking this medication. It is possible that progesterone could increase the risk of birth defects in an unborn child. Lactation use. Cuerpo Amarillo Fuerte Injection is not recommended for use in lactating women. If you are breastfeeding, it is important to talk to your doctor or healthcare provider before taking this medication. It is possible that progesterone could pass into the breast milk and cause adverse side effects in the baby. Acute overdose. If there has been an overdose of progesterone, it is important to seek immediate medical attention. An overdose of progesterone can cause some serious side effects, including fainting, chest pain, confusion, dizziness, nausea, and vomiting. Contraindication. Cuerpo Amarillo Fuerte Injection is contraindicated in individuals with a known hypersensitivity or allergic reaction to progesterone or any of its components. It is also contraindicated in individuals with a history of asthma, kidney disease, liver disease, and any other serious medical conditions. Use direction. It is important to take progesterone exactly as directed by your physician or healthcare provider. Do not take more or less than the prescribed dosage, and follow all directions on the medication label. Storage condition. Cuerpo Amarillo Fuerte Injection should be stored at room temperature in a tightly closed container. It should be kept away from light, heat, and moisture. It is important to keep this medication out of the reach of children and pets. Volume of distribution. The volume of distribution of progesterone is approximately 10 liters per kilogram of body weight. Half-life. The half-life of progesterone is approximately 8 to 20 hours. Clearance. The hepatic clearance of progesterone is approximately 3 to 6 liters per hour per kilogram of body weight.